If you've never heard of PCOS, Polycystic Ovary Syndrome, it's a health problem that affects 1 in 10 women. Here to shed some light on awareness and treatment is Dr. Heather Cook, reproductive endocrinologist at Coastal Fertility Specialist. It's good to see you again.
You also, thank you for having me.
Tell me, what is PCOS?
So polycystic ovarian syndrome is a syndrome that can be affected a pretty good proportion of the population. About 8 to 13% of women in the population are affected with PCOS. It's a multifactorial problem where it can affect people's reproduction, but also their metabolic, overall kind of general health.
And from what I understand, there's 4 different types.
There are different types. We kind of refer to PCOS as a spectrum where some people fall into kind of the bread and butter classic, and then we have people that are kind of on the other ends of the spectrum. The classic PCOS patient that people are most aware of, it tends to be kind of overweight, heavy set, has some extra issues with hair growth, things like that. But we have a lot of other PCOS patients that do not tend to fit that mold and tend to be like a very thin, lean PCOS patient that may have some of the features, but not all the features of the classic PCOS.
So it sounds like it affects the thyroid if you're talking about weight gain and things like that.
Well, it's actually more of our reproductive hormones, some of the hormones that come from the brain to talk to our ovary to tell us to have menstrual cycles and to ovulate. And that's why it can affect reproduction, because most women with PCOS are not ovulating and not releasing an egg. So it's difficult for them to get pregnant in that sense.
So it sounds like there's some obvious signs that you may be suffering from PCOS. Can you tell us what those common symptoms are?
Definitely. The most classic symptom would be irregular menstrual cycles. So patients traditionally are having periods every 3 months, every 6 months, in severe cases every year. And so that would be the most common finding of PCOS.
I see. So just a quick question, since you're talking about skipping periods, what does that say about some of the birth control that you never see a period for months, if not years?
Right. So really when you're on birth control, you're really never having any true ovulations or true cycles. That's how birth control works, by preventing you from ovulating. So you will have bleeding usually on some traditional birth control pills, but it's kind of like a fake period. We can give birth control so you don't have a period, but you're still not having the ovulatory process that you normally should be having when you're not on birth control.
What are some of the other symptoms that patients might exhibit?
So other classic symptoms are signs of excess male hormones in the bloodstream. And so that can present sometimes as excess hair growth on the face, abdomen, arms. Also infertility actually can be a presenting sign as well.
Okay. And is this hereditary, or does it just happen in the individual?
So we don't 100% know what causes PCOS, and there may be multiple causes that kind of cause the same final outcome or symptoms. We do tend to see it run in families, and so sometimes it can run in families. It does not have to always run in families.
Okay. And when you're speaking about infertility, so this would be someone who's trying to get pregnant and they can't because their menstrual cycles are so off?
That's usually the most common reason that these women are not getting pregnant, is simply because they're not ovulating, which is very good because it does allow for very simple fertility treatments in order to get pregnant.
Okay. Well, let's talk about some of those treatments. So when someone comes in and they've been diagnosed with PCOS, what's the first step towards regulating themselves?
So if a woman is not trying to get pregnant, the standard really is to just put them on birth control pills, and that will regulate their cycles and protect their uterus from any, bad things such as uterine cancers. If they're trying to get pregnant, clearly we're not going to put them on birth control. And so we do have fertility medications that we use, which are called ovulation induction agents. And so they are used to induce someone to ovulate and release an egg.
Okay. And what are some of the resources available for women in the Low Country who think they might have PCOS?
Right. So you can always go to our website, which is coastalfertilityspecialist.com. Our American Society of Reproduction, which is called ASRM, also has a lot of great resources online, which are very evidence-based resources for patients to look at.
Okay, great. And for anybody who maybe they're not interested in having children, they have PCOS, it's not really causing them too much discomfort, although it sounds like some of the symptoms are rather uncomfortable and they probably like to get it addressed. But does this just go away on its own? Do they have to be going through menopause in order to see it go away on its own?
Right. So it usually does not go away on its own. It is essentially kind of a chronic illness, if you will. And so it's managed kind of lifelong. And so again, the mainstay would usually be birth control pills. If they are having a lot of symptoms of excess hair growth, things like that, there's other medications that can be used just to improve those things for their overall lifestyle. And then clearly when they're ready to get pregnant, it would be more of a fertility-based treatment.
So you're saying that patients would take birth control pills even after they would have gone through menopause?
So usually at the time of menopause, they can choose to stop their birth control if they want to, and then it would be a discussion with their doctor if they wanted to continue other hormones for hormone replacement or just go off hormones completely.
All right. Well,
Mhm.
Dr. Heather, I want to thank you so much for joining us with that information. Of course, we're going to share your information on the Coastal Fertility Center as well. Thank you so much.
Thank you.
We're back after this.